Hi, my name is Courtney Guy. My capstone project was on abdominal binding as a preventive strategy for gaseous distension in preterm infants receiving non-invasive ventilation. This was brought to you by the Department of Nursing at Midwestern State University. And the professor is Stephanie Hoffman, MSN RN. After watching this presentation, the viewer will be able to identify the complications of bubble CPAP and NPPV in preterm infants, explain the rationale behind the use of abdominal binding as an intervention, review literature supporting the intervention, and acknowledge the proposed plan for implementation of the intervention as well as its evaluation and dissemination of findings. The rationale for this capstone project topic was mostly based on clinical observations. Many NICU babies were struggling with emesis during and after feedings and oxygen desaturations as a result of gaseous abdominal distension caused by non-invasive ventilation. Currently, there are limited standardized nursing interventions to address this issue. However, new research suggests that abdominal binding presents a promising, non-invasive strategy to improve the outcomes of these vulnerable patients. And in this picture on the right, we can see the apparatus that is used for both bubble CPAP and NPPV. This hat and mask combination is called a Fisher-Paykel system. The mask is secured to the face by Velcro straps, and the tubing is secured to the forehead with a Velcro strap and foam padding. The tubing goes to the respiratory device, which is either a bubbling canister or a ventilator for NPPV. And the infant is switched between mask and prongs every 3 to 4 hours to prevent skin breakdown. In the NICU, non-invasive positive pressure ventilation, or NPPV, and bubble CPAP are common respiratory support devices that are used to treat a common problem in preterm infants, respiratory distress syndrome, or RDS. The infant's immature lungs require positive pressure to keep the alveoli open upon exhalation. Unfortunately, this pressure is not specific to the lungs, and as a result, the stomach is also pumped with air. As a NICU nurse, a critical role in caring for infants receiving non-invasive ventilation is managing the resulting gastric insufflation and preventing CPAP belly syndrome. Common complications of abdominal distension include discomfort, impaired respiration, and feeding intolerance. CPAP belly syndrome can lead to extended hospital stays and poor weight gain due to feeding intolerance. This picture shows an infant's severely distended abdomen. Here you can see that the pressurized air extends the stomach and also insufflates the intestines as well. Sometimes bowel loops are even able to be seen. Current practices for managing gastric insufflation are not standardized to prevent CPAP belly syndrome in neonates. One intervention, orogastric venting, is common but often insufficient. My PICO question is, in preterm infants on CPAP or NPPV, how does abdominal binding compare to orogastric venting in preventing abdominal distension? So let's talk about what that looks like. Orogastric, or OG, venting is an intervention that relies on gravity to vent the air from the infant's stomach. This is usually done by attaching a syringe to the free end of the infant's feeding tube and elevating the syringe above the infant. In this picture on the left, we can see that the syringe is affixed to the parent. This is often done when a parent wants to bond with their baby by holding skin to skin in between feedings. You can also tell that this syringe is filled with milk because although air is released through the syringe, sometimes milk comes up with it as well. This practice can be compared to burping a baby. However, the picture on the right shows abdominal binding with the neo belly band by Dandelion Medical. The abdominal binder wraps around the infant's midsection, providing support and preventing air from further distending the abdomen. The OG tube should still have a syringe attached and be left open to vent while the neo belly band is in use to allow place for the excess air to escape. Bubble CPAP, including NPPV, creates so much pressure that swallowing coordination is impaired and the infant is at increased risk for aspiration if fed by mouth, according to Dumpa et al. For this reason, infants on non-invasive ventilation are only fed enterally through the orogastric tube. In clinical practice, abdominal girth is measured a minimum of once a shift. But how will we know when to consider the abdomen is distended other than subjective data? This is where research done by Citruk et al. Becomes paramount to creating objective data that can be standardized. They proposed abdominal circumference metrics that can be used to diagnose abdominal distension. By comparing the head circumference and abdominal circumference ratio, providers can gauge the severity of distension in infants ranging from 24 to 34 weeks gestation. According to McGill, in 2022, research supported abdominal binding as an intervention for gastric decompression due to findings that showed improved respiratory and feeding outcomes in neonates. To address this issue, the project proposes pilot testing abdominal binding in a NICU setting using the Neo Belly Band by Dandelion Medical, a specially designed abdominal support band for neonates. This testing would include clearly defined parameters and criteria. McGill 2022 suggests establishing safety criteria that only infants with normal stooling and bowel gas patterns may begin therapy. Key stakeholders include NICU nurses, neonatologists, neonatal nurse practitioners, respiratory therapists, physical therapists, and families of preterm infants. The anticipated impact includes improved comfort and outcomes for infants, enhanced nurse competency in preventing and treating abdominal distension, and reduced interruptions in care caused by gastric complications. Because care begins with the providers, neonatologists, and neonatal nurse practitioners would need to write an order for this type of intervention. NICU nurses would be at the apex of this intervention because the management of gastric distension is one of their main priorities. Therefore, they would be responsible for the application and monitoring of the Neo Belly Band as it applies to abdominal girth, tolerance of enteral feedings, and respiratory status. Respiratory therapists are included as stakeholders because they collaborate with nurses during infant care times to both manage the respiratory support and assist in infant positioning, a key factor in this device. The Neo belly band should be used while the infant is in a prone position with the head of the bed elevated to at least 30 degrees to provide optimal abdominal muscle and lower rib cage support, as suggested by Miguel 2022. Physical therapists assist with infant developmental positioning and range of movement while the infant is wearing the band. Families are always included in the plan of care and encouraged to care for their infant while in the NICU. Therefore, it is important to educate parents on the Neo belly band before and during application. The implementation strategy would start with approval from hospital, neonatal committee, and medical board. Then develop a protocol including criteria based on gestational age, weight, and ventilation type. Educate nursing and respiratory staff using workshops, simulations, and bedside guides. Provide video tutorials and step-by-step visual guides via the intranet. Inform parents with pamphlets and consents, and the medical team will explain different parts of that. Monitoring abdominal girth every 6 hours, documenting bouts of emesis, events such as bradycardia, oxygen desaturations, and respiratory support changes. And this would be a 3-month pilot in 2 NICUs with 30 to 50 patients. Evaluation entails comparing pre- and post-intervention data. A helpful tool that will be utilized for clear and concise data collection and analysis is REDCap. The main focus is evaluating feeding tolerance. Is the infant having frequent emesis? Abdominal girth? Is the girth increasing significantly shift by shift? And respiratory function. Is the infant having frequent oxygen desaturations, requiring more oxygen, or needing more pressure or respiratory support? Staff feedback regarding the ease of use and effectiveness of the Neo belly band will be collected using surveys. Some barriers to evaluating the data are variability in infant anatomy and inconsistent application and documentation of the intervention by nursing staff. This picture provided by Dandelion Medical shows the infant's abdomen before and after application of the Neo belly band. It is important to note that the intervention does not compress the abdomen, but instead supports the belly by stimulating the abdominal wall muscles. The band is cut to fit the infant's abdomen and is slowly cut more to compensate for the decrease in abdominal girth. You can see how distended the picture on the left looks and how normal the picture on the right looks. In these before and after pictures from Miguel's research, a significant change can be seen. The research suggests that abdominal girth can be reduced by as much as 7 centimeters in just 2 days. That's pretty incredible. In gathering evidence for this project, I was able to get in contact with a representative from Dandelion Medical who was able to provide sample belly bands. Representatives from Dandelion Medical also conduct presentations for NICUs, which would be used in the dissemination of this project. This PowerPoint would be presented to an upcoming hospital UBC meeting and would be adapted into a poster form for a session at a Fort Worth, Texas Association of Neonatal Nurses FWTA-NN meeting. For broader dissemination, a proposal will be submitted to the hospital's nursing education department to offer continuing education credit. Submission to a professional organization like the National Association of Neonatal Nurses, NANN, will also be considered. For this capstone project, I had the opportunity to interview a BSN prepared charge nurse in a level 3 NICU. Jasmine Pettyjohn offered insight into current clinical practices in her unit and expressed openness to participating in a potential implementation of the Neo Belly Band if possible. Pettyjohn emphasized the importance of nurse-driven protocols and educational initiatives to implement and standardize new practices in the NICU. In summary, this capstone project explores the prevention of gaseous abdominal distension in preterm infants receiving bubble CPAP and NPPV using abdominal binding. This topic was selected in response to observed clinical gaps and the lack of standardized preventive strategies across many NICUs. Abdominal distension, commonly caused by gastric insufflation by non-invasive ventilation, can compromise ventilation, feeding tolerance, and overall infant comfort. Although evidence supports the potential benefits of abdominal binding, guidelines remain limited. Using a PICO framework, this project proposes implementing a pilot protocol utilizing the Neo Belly Band by Dandelion Medical. Its effectiveness in reducing abdominal girth and improving patient outcomes will be measured using nursing staff feedback and documentation. The proposal emphasizes staff education, standardized protocols, and parent involvement while addressing anticipated barriers such as unfamiliarity with the intervention and safety concerns. The interview with Jasmine Pettyjohn, BSN RN, provided real-world insights, highlighting both the need for nurse-driven innovation and the current limitations in clinical practice. Ultimately, this project aims to improve neonatal outcomes, enhancing nurse competency, and support the development of evidence-based protocols that can be shared through professional presentations and continuing education platforms. And here are the references used in this project. Thank you so much for watching.